right? So we know it's generally 40 weeks. And so a premature birth is one that occurs before the start of the 37th week of pregnancy. And so Black Women's Health Imperative is a national organization that's dedicated to the health and wellness of Black women and girls. And when we think of prematurity and premature birth, we put it obviously under the umbrella of maternal health, maternal and infant health. And so I'll talk about the program that I am the program director for, which is My Sister's Keeper, which is one of Black Women's Health Imperative's signature program, created to empower young Black women on college campuses with a special emphasis on HBCUs, through skills training and leadership development to advocate for and contribute to their own health and well-being, as well as that of other Black women. And so we have 6 focus areas for My Sister's Keeper. And then the first is sexual and reproductive health, rights, and justice, mental and emotional health, menstrual insecurity and stigma, gender discrimination and violence, anti-racism and allyship, and anti-tobacco smoking and vaping. And so if you think of these, focus areas, they all impact the health and well-being of a mom. And so when we think of the reproductive justice framework, which is the human right to control one's body, sexuality, gender, and reproductive choices, this right includes access to affordable care, high quality health care that protects people from unnecessary complications and potential death, like we see with Black women in the maternal health crises and prematurity with infants. So that right can only be achieved when all women and girls have the complete economic, social, and political power and the resources to make healthy choices and decisions about their bodies, our families, and our communities in all areas of our lives. And so, when we think of maternal health, it's not its own focus area, because those focus areas for My Sister Keeper covers all the intersectionality, right, of what goes into someone having a healthy life, especially for young Black women of reproductive age, which is 15 to 44. And so in terms of what Black Women's Health Imperative is doing overall, in addition to the work that we're doing with My Sister's Keeper, is a recent partnership that we have to address the impact of racism in our country's maternal health care system. And so we've partnered with some key stakeholders in nursing, patient advocacy, policy and research, communities to develop a patient-centered, values-based, implicit bias curriculum that incorporates the lived experiences of Black women to improve provider awareness of this critical barrier to care. And so the work that we're doing for our maternal health partnership is an important body of work which will review the science, the interventions, and current policies related to implicit bias and racism in maternal health care. We will gather and integrate stories from Black women and their significant others and their families about their birthing experiences in the maternal mortality morbidity space. Of course, improve provider awareness, which is important, of the adverse effects of implicit and institutional bias, and then set some strategies for addressing these structural racism and systems of care delivery. So these are all barriers to promoting and improving maternal health at the national and state level. And so, of course, these recommendations out of this partnership will be included in a major patient-centered, evidence-based suite of advocacy tools and research interventions that will provide tangible solutions for achieving optimal maternal health care for Black women and Black women. For Black women by Black women, I'm sorry. And so that's just, an overview of what Black Women's Health Imperative is doing this in this space in terms of the partnerships and the curriculums and things that we're working on, and tools and resources for Black women that are created by Black women, but then also working with young women of reproductive age around the factors that contribute to having a healthy life and ultimately a healthy birthing experience. That was a lot, so.
No, thank you. That's all really great. And then so could you like kind of go into explaining some of the social determinants of health of maternal health that contribute to prematurity?
Yes. And I know that you sent me the questions in advance. And there are a couple after this, and they kind of all tie together.
Uh-huh.
So, meaning like the most prevalent social determinants, and then what are some reasons. And so if it's okay with you, can I kind of address all of those questions at
Yeah.
once?
Yes.
Because I always find myself saying, and like I said before, and it's just easier, it's, more comprehensive. And obviously I wrote out my responses. So it will help me so I won't forget anything to share with you guys. So
No, that makes sense.
So forgive me. I hope I sound as natural as possible, but I am reading what I wrote. I guess that's the best thing about virtual, right? And so in terms of social determinants of health and how that impacts the birthing experience for Black women, our health is determined in part by access to social and economic opportunities, the resources and supports available in our homes, our neighborhoods, and our communities, especially the quality of our schooling, the safety of our workplaces, the cleanliness of our water, food, and air, and then obviously the nature of our social interactions and relationships. All of these conditions in the environments in which we are born, live, learn, work, play, worship, and where we age, all of this affects a wide range of health and our quality of life outcomes and risks. So when we think of Black maternal and infant health, it's definitely in a state of crisis right now. And it's no secret, I think more people are becoming aware of what's happening, especially when we're starting to see some of these high profile folks who have the means to, get the best care, but still are experiencing adverse health outcomes. For example, Serena Williams, Beyonce had complications, all the way down to recently, in the beginning of November, a Black doctor who lost her life in the midst of giving during childbirth. So Black women and their infants are dying at higher rates. And this racial disparity persists regardless of age, socioeconomic status, education, and any other factors. So in fact, a Black woman with an advanced degree is more likely to lose her infant than a white woman with less than an 8th grade education. And so we, if you're in the public health space, they say, a protective factor is education, but now we're starting to see that even with higher education, you're more likely to have complications, which is scary, right? Because you would think getting a greater education would lead to more money, but that doesn't necessarily mean that you, as a Black woman, would have a greater birth outcome compared to a white woman. And according to the CDC in 2019, the rate of preterm birth among African American women was about 50% higher than the rate of preterm birth among white or Hispanic women. 50% higher. And so Black women are also twice as likely to lose their babies to premature death. Causes including, insurance coverage gaps, the social determinants of health that I spoke about, and then the prevailing reasons that are linked to racism and implicit bias. And so lack of access to high quality, evidence-based, culturally competent, and medically appropriate care that meets the unique needs of Black women and their communities are perpetuated by the shortage of providers and healthcare organizations, including contraception and pregnancy-related services that are accessible to Black women, that also results in higher rates of chronic health conditions. And then it's the social and economic and environmental stressors, including racism, poverty, criminalization, reproductive coercion, violence, and environmental toxins that harm Black women's health on multiple levels. So research shows that implicit bias negatively impacts Black patients' medical care. And one study finds that white medical students rated Black patients' pain lower than that of their white counterpart. And so you always hear, and you may or may not have heard, that Black women are saying that doctors need to listen to us. You know, we know our bodies. Why aren't you listening to us? But that's what's embedded into the medical establishment and the education that is passed on to those who become doctors, nurses, and other healthcare providers. And so another study in New York City found that Black college-educated women were more likely to suffer life-threatening complications during childbirth than women of other races with less education, which I pretty much already stated earlier, but it's just to show that even somebody with the means and the ways is still not being listened to. For example, Serena Williams, she told them that she had an embolism, but they didn't listen to her. So it's like, she knew her body. Why would you not listen to her? And so, you know, Black women are disproportionately impacted by risk factors related to pregnancy, such as hypertension, gestational diabetes. And obviously these conditions are made worse when compounded with stress, the stress of racial discrimination, lower quality health care, climate changes, and obviously right now we're in the midst of COVID-19. So, you know, the context of the social determinants of health, so what's happening in homes, outside of homes, and the systems that Black women have to enter, all impact their birthing outcomes and what happens to their child once it has entered into this world.
Thank you. That was a really informational answer.
Yeah, I know. I'm sorry. I just wanted to make sure I gave you guys enough.
But it was really, that was really great. Thank you. And so I guess, are there any like specific aspects of prenatal care that you can mention that contribute to prematurity? Or I guess like access to prenatal care or lack thereof that results in prematurity?
Well, we definitely know that there is a lack. Not all women who have a birthing experience actually get prenatal care. And we know that there's a disparity amongst Black women who get care and who do not, and what that outcome looks like, whether it's a preterm birth, loss of life, or what have you. But we know that prenatal care exists within the medical establishment and the structure. So we know racism and implicit bias is there. And we know that there are barriers to care, right? You know, especially among young people, people of color, people of low incomes, and other marginalized groups that don't have access. And so, you know, when we think of the prenatal care from the medical aspect, it's all about making sure that you're you know, you don't have gestational diabetes or some of those things, like the medical pieces, right? Let me check your weight and things like that. But what about the non-medical pieces, the emotional wellness and mental health of that mom at the time? Those non-medical needs aren't always addressed, and we know that those can show up to be barriers as to why they can't proceed. And so unless a provider is culturally competent and, you know, provides high quality care and care that's embedded in the lived experiences of Black women that enter the system, they'll be ignored. And they won't feel comfortable to come back. And so we know that during that prenatal care process, we know it's already a barrier to get there. So once they get there, there shouldn't be any barriers where the lived experience of the Black woman is ignored, because that will determine the outcome, their birthing outcomes. So yes, so getting to prenatal care, the care that you get while you're receiving it, and what the provider tends to focus on all shapes what that looks like for a Black woman and how it relates to her birthing outcomes.
Thank you.
Can I ask a quick question?
Mhm.
Yeah, sure. So, earlier, as you talk about all this, you mentioned sort of how we can sort of find evidence-based solutions. And so, obviously, as you just mentioned, there's so many more considerations that go on just beyond, for example, just the specific needs of African American women. Um, so I was wondering sort of what those solutions might look like, or at least what you've seen so far could work.
Yeah, so obviously the one is listening to Black women, right? And we know representation matters, but if you look at studies, having someone that looks like you tends to help, because you are less likely to feel uptight when you're receiving those services, and you're less likely to be discriminated against if it's somebody that looks like you. Now, whatever that patient provider interaction looks like, that differs, but we do know research has said that it's better, you have better outcomes when you have a provider that looks like you and that understands your lived experiences. So obviously representation is evidence-based, that shows to have worked. But then also the training, right? Obviously culturally competent training. I mean, there's so many words that people use, right? Culturally competent, cultural humility, culturally sensitive, right? And so whatever name you use, those core components of it are effective, right? Because if you listen to your patient, if although doctors have to do whatever they got to do and they have 15 minutes, but if in those 15 minutes you care, you ask about what happened, did they have any challenges getting there? But if you're more likely to show compassion when you're talking to that person, then that is, evidence-based and proven to show better outcomes, because that person is more likely to come back. Now, I'll be interested to see what comes out of our partnership with some of the other key stakeholders about what else they found. Because I know we were doing some focus groups with Black women and their birthing experience, and then obviously working with nurses and doctors to see what other levels of training is effective, right? But we all know that, representation and being able to connect and being sensitive and aware of the lived experiences of whoever interacts with healthcare providers or the system is proven to be effective at some level for any person.
Yeah, thank you. Yeah. Recently, there's a public health institution at Harvard called RNA Labs, and they have a department devoted to sort of maternal care and childbirth. And recently, they published sort of a global study that they found that they were able to construct a literal checklist, for example, during childbirth operations and during that moment of patient interactions, in which they found that was actually pretty effective in supporting outcomes. So I thought things like that were also interesting to hear about as well.
Yes, and there is another group, a body of folks that are working together to create like these bundles. And so not bundles like I'm gonna put all this stuff together and give it to you, but like a checklist, right? To say when a pregnant woman comes in, do X, Y, and Z. So, there's some other groups that are working on that and seeing if checklists make sense, right? And even with postpartum care, after I don't know, I think it's like 1 or 2 visits or whatever, within the 6 months you got to come in. But after that, what happens? There may be lingering effects of that childbirth after 6 months. So what services can those women receive? So yes, the checklist is definitely seeming more like the way to go.
Okay.
in
Yeah,
terms
thanks for sharing.
yeah.
Yeah, it's great to
Thank
hear.
you for your question.
And I guess this one's a bit more medical, but what are some of the short-term risks of prematurity, short-term health risks, and which populations, premature babies, face obstacles to the treatment for these risks? I guess, like, how accessible is the medical care for any short-term risks associated with prematurity?
So yeah, so you know, that question still brings me back to the lack of access, right? And so when we think of the ACA, we think of Medicaid, that has insured more people than before who have had pre-existing conditions. And we know that gestational diabetes also impacts the birth and outcomes, hypertension, and some of those other things, right? And so unless someone has coverage, they won't be able to access the services. And so if you think about, I think a research study showed that where there was not Medicaid expansion, there were more uninsured Black women. So that's a problem. So now we know that in those states where there is Medicaid expansion, there have been better birthing outcomes for Black women and women of color. And so we're seeing, obviously, if they have insurance, they can mitigate whatever those outcomes are for preterm birth. And so I'm thinking of, when I think of short term, right, the child is sometimes, if the child comes, 20 weeks, 30 weeks or whatever, that child has to go into the NICU. So their lungs may not be fully developed, so they may not be able to fight off infections. Some of they may not have been fully developed, so there may be some vision impairments, some intellectual impairments. And so those are some of the short things that I can think of. But in terms of long term, obviously, like I said, with if they're not fully developed, there can be, lung problems, so asthma and some other lung diseases. There could be some mental health issues. I know I saw that ADHD was actually an adverse effect of preterm birth. And so those are just some of the ones that come to mind, honestly, about that, whether they're short-term or long-term. But I think the one that most people really harp on is the infection piece, not being able to fight off infections, and also not being fully developed when you're preterm.
Going off of the infection part of it, I guess the compromised immune system, how do you think COVID-19 has disproportionately affected Black premature babies compared to other populations?
So, I mean, obviously, not being able, studies have shown that child having direct contact with that mom is so important in the first stages of life. And with COVID-19, I remember I saw an article about Indigenous women where they were being separated from their child, whether they were preterm or not, right? And so obviously, given the novelness, I'll say, I don't even know if novelness is a word, but whatever, the early disease state, right, of COVID-19, and we're still learning, we don't know the impact. So obviously, if a child is born preterm and is more susceptible, then that mom may lose that needed connection time with her child, which obviously will lead to some other impacts later on life, because we see that even in some research studies, they're saying that mother to child contact that happens in the first few hours or days of that child's life impacts what the relationship looks like down the line in terms of mental health, and being able to emotionally connect with folks. And so definitely things are being exacerbated, and it just sucks, right? Because COVID-19 is literally any issues that we've had ever in life. COVID-19 has just said, hey, I'll show you how this impacts that, unfortunately.
Yeah, that makes sense. Thank you. And you spoke about the long-term health risks that premature babies can face. And I guess kind of related to, you already touched on it a little bit, but related to like the access to care for premature babies. I guess, how does racism directly impact Black premature babies? Because you spoke a little bit about how it impacts Black mothers. But yeah, I guess that was my next question.
So yeah, well, obviously, just like when the child is in the womb of the mom, however the mom's life is going at the time, whatever is impacting the mom's body will affect the child. And so when you think of coverage, if the mom doesn't have coverage, sometimes that impacts what services the child can receive. Now, I know, and I'm not an expert in this space, but I believe that with Medicaid expansion, even if the mom does not have insurance, she can get Medicaid, right, to make sure that the child is insured, and I think it's for a certain amount of time. I'm sorry, I'm not a Medicaid expert. I just know that it has been working, right, for outcomes.
The details are
Yeah, and so right, it's crazy, and if they're not expanding it, it's bad. So when we think of what that insurance process looks like for the services for a child, there is a time frame in which whatever services that child needs stops, right? And so I think, and don't quote me, I think it is 6 months, right, for the mom and for the child. And so, for example, if that mom is already, impacting loss of wages, homelessness, or whatever some of those social conditions that impact a mom, be it the vehicle of racism within systems or whatever, that will ultimately impact the extended care that's needed for the child. And so I don't know if that answers your question, but
no, that makes sense.
Yeah.
And so that was like the last of the planned questions that I had, but does anyone have any questions they want to ask? If you guys can put them in the chat, I'll give you. I had a question about, you said criminalization earlier, and I was wondering if you could expand on, I guess, criminalization and incarceration, and how that, like, what the intersection of Black maternal health and those two factors are, and also how that affects, I guess, like postpartum health outcomes, as well as like the baby's health. Sorry, that's a really loaded question. But
it's fine.
Just kind of looking at those two.
That's all within the realm of reproductive justice, right? And we're actually seeing an increase of more women being incarcerated, whether it's criminalization through, I don't know if you guys ever heard the story, but it was a Black mom who got into a fight, right? She was pregnant. I think she's probably like 3 or 4 months or something like that. She got into a fight with someone. She didn't start the fight. She got into a fight, and whoever she got into the fight with, the person fired a gun, whatever. I can't remember if she was shot or, anyway, it was assault. Obviously, police were called. That mom was locked up and then charged for the death of her child, for losing the baby, for having a miscarriage. And so criminalization like that, how am I charged for a miscarriage of my child that was the result of someone attacking me and me defending myself? So criminalization in that way. Even with the laws around abortion, and not having access to it, what that looks like. And the more women that are being incarcerated for whatever reason, right? Sometimes if they don't have, this cash bail system, right? That criminal justice structure impacts reproductive justice, right? Because if that mom is pregnant and, I don't know, gets a traffic violation and then in turn is in jail, then she may not receive adequate care from the criminal justice health services. And I don't know if you guys heard, with the forced sterilization and what's happening with women of color in jails, but, that's still happening, right? And so even saying, because I'm in this system, you guys are committing acts of violence against me and sterilizing me because you feel that I should not be able to produce a child. So you're violating my reproductive justice and my rights to have a child, whatever, no matter where I am in this world or what system that I'm in. And so, just the increase of more women showing up in the criminal justice system is having an impact. And, there's so many crazy stories, from forced sterilization to a mom not receiving medical attention while she's giving birth and basically just had the child chained, handcuffed to the bed. That creates trauma on the child. And you also know that when women give birth within the criminal justice system, whether in prison, jail, sometimes that child is taken away immediately. So that, there's reform happening to say, well, don't take someone's child away from them immediately because of the importance of having that mother-to-child contact. And so that's just some of the ways that, criminalization of women is happening, especially in terms of women who are pregnant and how they show up in the criminal justice system and how state violence happens to them, be it in the system or outside of it or as a result of it. Yeah.
Thank you. Does anyone else have any questions you want to put in the chat, or you can unmute yourself and say them out loud?
I'm not an expert, but I know a little something.
No, you're very knowledgeable. We've learned a lot from you so far.
Yeah, for sure. I had a quick question. So I know you mentioned this, but after like the mother gives birth, I know postpartum depression is pretty common. So I was wondering if you could speak to a little bit about how that plays into effect, especially like within the Black community, and how that's handled. Because I know, like, in general, it's kind of looked down upon, and people are just like, why are you like depressed? Like, this shouldn't be happening, and things like that. So I was wondering if they have that access to those facilities to address that and things like that.
Yeah, and so, when that postpartum care for mothers after they've given birth, again, that's only the 6-month period, right? So the doctor will ask you how you doing in 6 months, and it may not show up right then and there, right? It may not show up until the child starts teething, and then it's triggering you. And as we know, like, access to just preventive services, right? So access to get contraception, access to, even, get a physical is already, barriers are presented to folks when trying to even navigate the system. So obviously there's definitely huge barriers that still need to be addressed in terms of getting mental health services. A part of it is, if someone isn't already exposed to mental health services prior to, they're least likely to go and access it even after having birth, even knowing about it. There's stigma, right? I shouldn't feel some way about a child I just birthed. And so there's still a lot of education and awareness that needs to happen for moms, right? What are those signs? And sometimes it's not the pamphlet that the doctor gives you and say, okay, I can't wait to see the baby when the baby turns 1, because what happens? And, when we think of mental health services, obviously COVID-19 presents even more barriers, right? Because if you already didn't have access, you really won't have access now. And let's not even talk about what's happening in rural. But it's a challenge, right? Because there still is stigma associated with going to therapy. And for Black women, it's even harder to ask for help because you're not supposed to feel any kind of way other than joy, love for your child. But we do know that moms have children in adverse conditions. There may not be a stable home. There may not be a healthy relationship or partnership with the father of the child. And so all of that impacts it. And honestly, I don't know what the numbers are, but I do know that there are barriers, and there has not been a uptick to success. I'll say that right now, because we're still trying to mitigate it and address that. But that is a huge problem. And I do know some folks who are trying to do preconception therapy and trying to, to prevent what happens postpartum, because everyone needs those tools, even outside of, the birthing experience, just in general. It's hard when you are experiencing those symptoms, right? But you don't know where to go and what services to get. So I hope that answers your question. I know
Yeah, it does. Thank you so much.
I just always get excited when I get to talk to students about this, and I'm like, yeah, so this is this and this and that. So yes, feel free to reel me back in.
Okay, so this is not a well formatted question, so take it as you will. But I wanted to know if you knew anything or like have explored access to prenatal care, whether that be like in rural areas or just in certain neighborhoods, and if there's ways that we should think about addressing that access, as well as like, I guess second part is, are there like a decrease of mothers who actually seek out prenatal care for reasons that they think they'll be discriminated against? And is there like anything you know about that?
So that is not really my expertise. I kind of know like the bird's eye view of what's happening, because even for Black Women's Health Imperative, we actually don't provide direct services. But obviously through research and just connections with FQHC, so federally qualified health centers, and just through our partners and what we're hearing, there are a lot of organizations that are funding community-based programs in areas to deliver preconception counseling and, support to do that. And obviously, funding those places would, I guess, increase the likelihood of pregnant moms coming through the system, right? Because you're creating the access to a program that guides you. And so I'm starting to see a lot more of that. So funding to community-based programs to help, women navigate through the health system and through their pregnancies, but I can't really speak to it in depth. I can just kind of give the bird's eye view of it. But there's definitely some work and some funding being put towards programming in areas to address that, whether it be peer navigators, health navigators, or whoever to navigate these systems, and to create some incentive, right, for women to get prenatal care.
Does anyone else have any questions you want to ask?
I can ask a question. I just want to say thank you so much for taking the time to speak to all of us today. This has just been so informative and wonderful. And like Becky said, this question also is a little needs to be fleshed out. But basically, I know that the Biden administration has been talking about kind of looking to the California Maternal Quality Care Collaborative as its basis for how it's going to deal with Black maternal mortality rates. And I was just wondering if you think, considering California's rates are still very high, if this is actually an effective thing that the administration should be relying on, or if it's better that they start looking to activist organizations or organizations that have been doing this for much longer than I think Joe Biden has been thinking about it, to actually do good for this incredibly large issue.
Yes. And so I don't know a whole lot, but I'm assuming that coalition or collective in California, they're the ones who were giving moms $1,000. Is that the same folks? If you don't know, that's okay. But I do know there's a collective from California that were like giving moms like $1,000, right? Now, $1,000 isn't a lot, but it's enough to help mitigate some of the challenges of, that may come out of either having access, transportation, food, and things like that. I think, obviously, trying to see what this new administration is going to do. I think, and also having Kamala as the VP, who is obviously aware of what's happening with the maternal health crises. She's, supported legislation around fibroids and fibroids research as it relates to Black women and women of color. I think there's opportunity, and I think that I think having more advocates, right, and having more women speak and go to these meetings and advocate for and get new bills introduced to really address it. I'm sure, like I said, because of who the VP is, that there will be a connection to the Black Health coalition that's created through the Congressional Black Caucus. So I know that there'll be some connections down the line of, having some experts, some community people who are doing the work, who definitely have, proven methods, whether that's, doula training, whether that's alternative birthing experiences. So, I don't doubt that they would get a great framework to really address this and hear other folks. But yeah, I'm just interested to see what else they have coming. But I think we have a better chance now than before to help address this, if that helps.
Yeah. Actually, I just looked into this as you were speaking, and apparently it's quite similar to the sort of checklist that we're talking about in terms of, maternal health toolkits to sort of guide decision making. But I guess, what the studies have found is that, while it helped the entire states of California reduce maternal mortality rates by several times in the past, by like 3 to 4 times in the past decade, like the racial gap that exists between childbirth complications between African Americans and other communities still remains extremely high. And so I think you've definitely addressed that, and when you talked about culture and being sensitive for the specific health considerations concerning targeting Black women. And so obviously that's something that we hope would be integrated into this plan as well.
Yes, thank you for looking that up. I'm still trying to remember I had to be California that was giving out $1,000 to moms that were pregnant right now. I don't know, when I find it, Rami, I'll send it to you.
That's great. Thank you.
And I think our organization, I think we had posted something about it because it was like a step in the right direction, right?
Mm-hmm.
To really provide some, because honestly, when we come down to what these outcomes are and what impacts is money.
Yeah. I had a question about, you mentioned doulas and midwives. So I was wondering, does do different birth methods carry, I guess, different outcomes for the mother and the child when it comes to like addressing the Black maternal mortality crisis as well as like Black prematurity?
Oh yeah, definitely. And I can't reel off any numbers for you, so sorry, but
The numbers aren't
totally. Yeah, I know, I'm like, but
no,
but yes, to answer that, yes, because I've been in conversations and attended events and heard speakers in the space talk about it. But yes, and even and I think I shared this when I was speaking for the fundraiser piece, but my best friend, who actually was a part of the focus groups for the work that we're doing for our maternal health partnership, she had an experience with a primary care doctor when she first found out she was pregnant, and she hated it. She didn't feel like she connected with the person or whatever, and the person wasn't Black, I'm sure. And so then she, paid her own money to get a midwife. Her midwife was a white woman. And because my best friend started to have complications because she found out she had preeclampsia, when she was in the hospital, she was being ignored. She wasn't being listened to. She didn't know what was going on. And when her midwife came in, a white woman was like, so no one came and checked on you? So the midwife is asking questions, right? And so had she not had a midwife who still stayed with her through her actually having to give birth in a DC hospital, I honestly think that my best friend could have lost her life. Although she was hemorrhaging and it was very scary, her blood pressure dropped, but just having a midwife there to tell her like, no. And when the nurses came in and they saw her sitting there, do you need this? Do you need that? So, we know that that's what happens. And so when you think of doulas and home births, because my best friend wanted a home birth, right? So that's why she, went through all the measurements to do that. But obviously life, and she had to give birth in, that's a traumatic birthing experience that she had. But we do know having midwives and having doulas especially helps eliminate that bias that happens in a hospital room, and even how from the doctor down to the nurse, who you probably will see more than a daggone doctor. And so it definitely has an impact. And I forgot what the daggone question was. Sorry.
But yeah, no, you answered it very well. That was because that's always something that I wonder is the different types of people that play the roles in I guess the whole pregnancy process before and after.
Yeah, and some people are, they don't want to wait right until the system changes, right? They don't want to wait until all these doctors get implicit bias training, when there's an alternative where they will have the support. They don't have to worry about not being listened to and not heard because there's someone trained who understands their lived experience and can assist them at home. And not in those systems that perpetuate some of these maternal mortality rates. So definitely.
Thank you so much. Does anyone have any other questions?
I hope we have some doulas, midwives, nurses, some doctors on this call today. So we can help figure this out as the next generation.
Yeah. You've been so, I've learned so much tonight. So thank you so much for coming in to talk to us.
Thank you guys for having me.
I'm gonna stop recording this.